and somehow the patient become very passive. There's nothing actually they're doing. That's why there's this belief, oh no, I'm going to get a pill to put it in, everything going to be fine. In lifestyle medicine, the patient is the driver. We kind of assisting them to change. And that's very, very important, especially the point you raised that, of course, if you people have to take their medication, because if your blood pressure is 200 over 120, and by all means, they get some medication that can, work on your arteries, your vessel, to be able to reduce your lower the chances of having hemorrhagic stroke. But in the meantime, they start doing something to clear that, to clear that in those atherosclerosis, making the vessels healthier. In that way, then together with the physician, you can start now reducing the medication you're taking. But it's very important that the patient shouldn't, unilaterally just stop their medication. Yes. It needs to be in conjunction with the doctor.
Yes. And Ernest, I think it goes back to what you mentioned earlier, that, these conditions didn't develop overnight, right? Definitely. So the way to change them is also not going to be overnight, right? The treatment. So you can't just throw your medications and then say, okay, I'm going to start eating broccoli every day and expect that immediately your blood pressure is going to go back to normal, right? It's probably going to take at least months for it to slowly go down and then, be normal. So definitely you want to emphasize that. Don't just throw away your medications.
Definitely. Yeah. And of course, integrating lifestyle medicine into the traditional practice, it comes with a whole set of challenges. It's I mean, both personally and professionally. I can imagine, I can think of, you find that, number one, you need to educate patients to understand there is no quick fix, okay? While they are used to the quick fixes, and not only that, even just you have maybe private medical setup, if it is a patient come with a high blood pressure, it's easy to renew the script, and in 20-30 minutes time, the patient is gone.
Absolutely.
But now if we have to really educate the patient, like you mentioned, you need to find where the patient are, what kind of support system do they have, and how you can now specifically adjust the prescription tailored to that patient, which takes time.
It takes time.
In that way, if you happen to have a really queue of patients coming to your practice, you are not going to finish that. So what are the challenges do you think, especially young the doctors, even the young doctors face when it comes to integrating lifestyle medicine into their practice? Because financially it's going to affect you, and also time-wise, how do you think how to deal with this?
Okay, so I think you asked a couple of questions there.
I know.
So definitely going back to that first point of what are the challenges. So as you mentioned, time is a very big one, especially as a young doctor. Early on in our careers, we just have to go, push. Mostly if you work in government, you're a queue pusher or, a ward work machine, right? So you just have to do the work. And you barely get the time to talk to the patient, right? Some people don't even know, the name of the patient's spouse or basic details like that. So to find out what's your support system, what are you currently eating, what do you have available in your community, things like that. Where can you exercise? It does take time. So definitely for young doctors, time is the biggest one. There just doesn't seem to be enough time. And it seems as if the employers actually don't expect us to do that. They just want us to push the queue and to see that, the greatest number of patients in the shortest amount of time. And even working in private on your own, still you will be a slave to the time because patients get anxious outside. It's been 15-20 minutes, when am I gonna go in next? So definitely time is a big one, but I think how we can sort of target that is that just take 1 minute or 2 minutes to ask the patient what in their lifestyle do they most want to change right in this very moment. What's the one lifestyle thing? So this is something that ideally you'd be doing over multiple sessions, obviously, because you have to explain what the lifestyle principles are. And then the next session, maybe we could ask, okay, which one of these can you do? How can you start? So basically it's at every visit, probably negotiating as well with the patient to say, okay, let's make one simple change for this visit, and then you'll carry it on at the next visit. We can review, see if we need to change, if we can increase the intensity of this change, add on other changes. So honestly, I think it takes some creativity, because if you literally don't have the time, then it does seem quite impossible. But if you have the flexibility, especially if you're in private practice, maybe you can sacrifice in the beginning and, take a little bit longer with your patients, so that in the future you don't have to see them as often, or, you have a healthier population. And people always think that, if my patients are healthier, they're not going to come to me. That's actually false. If your patients see that what you're giving them is working, they'll actually come to you. You won't believe how many patients came to see me just because they wanted to talk.
Definitely. Yeah. No, what you say is very true. It's very one may think we're preaching ourselves out of this
business.
profession. out of our business. But I think like you mentioned, once you can just sacrifice, and I think that's the way the love of medicine comes in, because really to think it out, you want to make the patient better, and once that is your focus, somehow then you can have that 10 minutes just to talk to the patient. And I think also the more we talk about this, I think the patients also, they start changing, understand, hey, actually we need to change. Also to often the patient, to help them understand that like what you mentioned about Thomas Edison, the doctor of the future, we interest the patient in how their physiology, how the body works, and what they can do, and not to tell them, hey, actually, yes, you for now you worried about this now, but if you take this approach, it's gonna produce results in the future exponentially. And what I always tell the patient is, often we often, I think that's how general we are. We think of ourselves. The parents, they think of themselves. But when you started seeing that as generation problem, your kids, if you don't change now, your children won't change. Invariably, that's what we have. This some of these lifestyle diseases, they go through the family. It's because the families don't change. They continue
the social context.
They continue doing what their parents did. And often what we have today